There's two types of radiation that would be considered standard. Number one is a machine. It's called a linear accelerator. And patients lie on a table and the machine generates the energy or the photon that then travels through air to treat the target, which many times would be prostate cancer. We also treat bladder cancer, testicular cancer, and some kidney cancer here at TUCC. The other would be a form of what we call brachytherapy, or most people say brachytherapy, and that involves using radioactive sources or seeds. And the term brachy implies at close range. It's a Latin term, so you're actually taking the radiation and putting it right into where the cancer exists. So there's no travel through the air. Low-risk individuals may be treated effectively with external beam radiation or brachytherapy, where intermediate to high-risk individuals, from a radiation standpoint, may require brachytherapy combined with external beam radiation, or external beam radiation alone. Many times we'll combine that with hormone therapy. CYBERKNIFE is a form of what we call extreme hypofractionation, meaning that hypo is fewer and fractionation just means how many times we treat a patient. Conventional or standard external beam radiation takes place in general over 8 weeks, so about 40 fractions. So on the other end of the spectrum would be something like extreme hypofractionation, which doesn't require CYBERKNIFE to deliver that in perhaps 5 fractions, but for 5 fractions to equal a course of 40 fractions, you have to give higher doses of radiation. It's for the most part investigational at this time because we don't have what we call prospective randomized data that have followed outcomes and followed side effects for many years to establish this as a standard treatment option like conventional external beam radiation or brachytherapy. Simply stated, experience speaks volumes. Since we opened 8 years ago, we have diagnosed and treated more prostate cancer really than any other place, any other facility in the Rocky Mountain region. Over that period of time, I think that bond develops because they realize that there's some camaraderie, they meet other people. We have some men that develop friendships that are life-lasting. We have some men that actually continue coming every day and sharing time with their friends that are still completing their treatment. I'll sometimes go back, there's one area called a gentleman's club where they all meet prior to getting their treatment, and I'll see men that have completed radiation a couple weeks before. They're still coming every day just to hang out with everybody else. And so I think that also speaks to the events that we have structured for survival. So we have patients that then form a team that sign up for our Blue Shoe Run, or we just had a Survivor Picnic, which is a national event. And so you see a lot of your former patients and patients that have made friendships that are lasting throughout the years at some of the events that we have structured, focused on the survivorship after all of that's done. Prostate cancer, if you look at what I talk to patients about, I talk to men about collaboration. We have to have a greater voice when it comes to our own health. As we're trying to promote the Men's Health Clinic here, if you look at this government task force recommendation, the preliminary recommendation of no PSA screening, was made, and you heard nothing. You heard nothing from men. Now, they also did a recommendation regarding mammography for women, and in 24 hours you heard a firestorm of controversy where Obama himself was defending his policy. That's the main difference. And so with men, I think that we need to recognize that we're in control of health, our own health care, and we need to participate, create awareness, speak to each other, and raise money, for instance, for research, because in the past 5 years, we've seen an explosion, if you will, of new treatment modalities, for prostate cancer. And it tends to be, downstream in a metastatic setting, but those things now are moving upstream. So I think there's a lot of things happening where you look at the past 5 years, we didn't have 5 things in the previous 30 years. And so it's an exciting time, I think, technology-wise. Radiation continues to evolve. The radiation I do today is not even what we did 10 years ago.